what I'm going to talk to you about today is why research inclusion is a really important part of your funding application. And I'm going to provide a background to what we mean by the terms equality, diversity and inclusion, and specifically research inclusion in the context of NIHR. And then I'm going to talk you through some of the ways that you can think about and embed research inclusion throughout the project lifecycle, which is what NIHR is looking for you to do. So just to start off with a few key concepts then, these might be familiar to you already, but I'll be applying them in a research context. So equality, diversity, inclusion and equity are all really key concepts in research inclusion. Equality is about taking a systems approach to recognising and dismantling some of the barriers that mean that people don't have equal access to opportunities. And diversity is making sure that people, whatever the unit is we're talking about, whether it's a research team, whether it's an organisation, that there is representation of people from all different backgrounds with different characteristics at all levels. And the all levels is really important, and that people have kind of a voice is really key too. When we think about research, often researchers are very keen to attract diverse samples and diverse perspectives, diverse public involvement. But what's really key is that we can't achieve and sustain that diversity without thinking about inclusion. So inclusion is absolutely fundamental and requires us to unpack and perhaps change some of the things that we do, the status quo, I guess, because if we simply keep doing everything we're doing, but try and get more diverse people involved, then it often isn't going to work out. And so inclusion is making sure that everyone is able to kind of meaningfully participate, that they feel that they belong, that they're respected, and that they have, they're able to kind of achieve their full potential, make their full contribution. Equity is another term that is about sort of taking more of a justice or fairness-based approach to recognizing some of the fundamentals of kind of barriers, I suppose, to equality. So sometimes people will think that equality is just about treating everyone the same, which is a bit of a misconception. Equity really recognises that different groups of people need different things because of the particular kind of combinations of privilege and or disadvantage or structural discrimination that they might experience. And so, for example, there might be a justification for having single-sex provision for women, but there might not always be that same need for single-sex provision for men. So it's really about understanding what each group needs and meeting those needs rather than kind of going for everyone the same approach. Now, when we start to think about, what do we mean by research inclusion, it is really very broad. So we could start with the 2010 Equality Act and the 9 protected characteristics. But if we stop there, then we miss out on some really key aspects. So we miss out on particularly socioeconomic status, which is absolutely fundamental to underpinning health and care inequalities. But we also miss out on caring responsibilities that aren't captured by the Equality Act, such as caring for older adults, neurodiversity and neurodivergence, literacy. And importantly, that might be written literacy, but it might also be health literacy or digital literacy. And recognising what NIHR terms underserved groups. We might use other terms, but that is kind of NIHR's preferred terminology. And it's a really broad range of groups. I signpost in the resources to some guidance on underserved groups, and it could include prisoners, homeless people, Gypsy, Roma and traveller communities, asylum seekers and refugees, young people, people who are pregnant, people who are unemployed. So really very broad ranging. And it's context sensitive as to who is underserved in what context. Geography recognises both kind of unequal distribution of research funding and how there are particular parts of the UK which see much less research activity. But it also recognises some of the barriers of accessing health and care that might be associated with living in rural and coastal settings in particular, and the need for interventions to be developed and tested across a range of settings, not just major urban settings. And also, and I'm sure pertinent to many of you on the call, recognising career stage and sector and how opportunities to be part of research are not evenly distributed, and particular support that's needed for early career researchers. And that's why events such as EGGA are so important. But I'm sure that you can see yourself in multiple of these characteristics, and that's why intersectionality is really important to understand how particular types of kind of disadvantage or barriers can be magnified or made more complex by the combination of people's different characteristics. And so when we're thinking about sampling, when we're thinking about analysis, when we're thinking about public involvement, we really need to sort of have intersectionality in mind and recognise sort of diversity within different characteristics. So when it comes to research, then we could simply say that research inclusion is the right thing to do, that it's morally valuable and a sort of fundamental to include everyone in research and make sure that everyone can benefit equally from research. But there is a strong science and business case too. And so within this, our research needs to identify and target the populations and geographies where need is greatest. So it's really important to kind of be able to do some research into which types of population or setting or site are underrepresented, and to be able to target those and to recognise that, you know, areas of highest burden of particular health or social care needs would be important to target. We also need to make sure that we're kind of challenging and changing research practices which exclude people that are most marginalised and underserved. And as I'll talk about a little later on, some of the research practices that, you know, have just kind of been reproduced over and over, that are fairly standard research practices, are actually quite exclusionary. And there's a need for kind of more innovation and creativity to try and overcome this kind of ongoing exclusion of people. And those people that are excluded from research are often those that are most underserved with regard to their experiences of health and care and their outcomes too. We also need to reduce the research waste, which results from conducting studies that can't be more widely generalised. And in order to do that, we need to make sure we're collecting the right data about our samples, whether that be from primary research or secondary data, to be able to know who is actually in that sample. And yet often this isn't the case. So when you start to go through the literature, you may well find that there are big gaps in terms of what kind of EDI data has been captured. And we need to know whether some groups of people are adversely affected by what has been developed by new research, whether it's an intervention, service, care pathway, a policy, even if it benefits the majority of people. And I know I'm not alone in being very mindful at the moment of the shift from analog to digital and the benefits that that can bring in terms of making health and care more accessible, giving people more sort of involvement in the management and coordination of their care. But it can also leave people behind in relation to digital exclusion and digital poverty. And that's something we need to be really mindful of in research. And finally, we need to avoid harm by developing interventions which have been tested on a diverse sample. So something I'll mention in a moment is an NIHR's new sex and gender in research policy. And there are many examples of where women in particular haven't been included in the development of new treatments, particularly drug treatments. And then when those become widely available to everyone, more adverse events are witnessed amongst women than amongst men, because they simply haven't been part of the development process. And there are parallel examples in relation to ethnicity and skin colour as well. So there are a couple of key NIHR policy developments that it's really important for you all to be aware of if you're not already. And the first is research inclusion as a condition of funding, which came in towards the end of 2024. So this will apply to all domestic calls now. It's also applies to all global calls as of last month, and some of the infrastructure awards too. And so what this means is that inclusive research design is now a condition of funding. So it absolutely has to be attended to in your application, at both outline and full stage in different ways. And that you have the opportunity and indeed the requirement to cost for inclusive design kind of measures and resources. And that's a really positive development because it means that you can include those costs that are required to make your study more inclusive. And this research inclusion as condition of funding has been embedded across the funding pathway, right through from the application guidance and what you write in your application through to monitoring and publications at the end of a funded award. So we recognise that word count is very tight at stage one. But what you should really focus on at stage one is recognising inclusion aspects and inequalities in the background and rationale section when you discuss your sampling strategy and recruitment and any exclusion criteria. And then your research inclusion costings would be in your overall cost figure. And then at stage two, if you're shortlisted, then your detailed research plan, you've got a lot more space there and you can talk about inclusion in the whole research life cycle. And I'll explain what that means in a moment. And your costing would be a specific budget line in the detailed budget, which you submit after a recommendation of funding. So then what happened last year, again, towards the end of 2025, is that the sex and gender in research policy was launched. And this is closely linked to the cross-sector, it's part of the cross-sector message initiative to really kind of interrogate sex and gender in research and to make sure that findings are disaggregated by sex, gender, or both, depending on what's appropriate to the study. And to think through sort of your sampling strategy with regard to sex and gender, and to really think about whether any sex-specific exclusion criteria are really necessary and clinically justified, or whether they're just sort of a bit of a legacy of previous exclusionary practices. So again, this is about thinking about sex and or gender across the whole research life cycle and similar requirements in terms of what you say at outline stage and what you say at full stage. But it is really important to be recognising this policy and to be applying it to your own research in both stages, and also to make sure that any analyses are disaggregated by sex, gender, or both when it comes to your full stage application. So I've mentioned the need to embed inclusion across the whole research life cycle, which is NIHR's terminology. And so in terms of what this means, if we follow this wheel anti-clockwise, then it means starting with the conception of your research idea, so your research question and how you're justifying that in your rationale, through to building your research team and thinking about the strengths and skills of your team, how you're involving people and community, through to sampling, data collection, how you analyze and present the data and the kind of terminology that you use around equality, diversity and inclusion, knowledge mobilization and budgeting. These are all parts of the process where inclusion can and should be embedded. So the former Research Design Service Equality, Diversity and Inclusion Toolkit was developed to help researchers to think about how they would embed inclusion across the whole research life cycle. And this toolkit's currently being updated, and there'll be a new shiny version available in a few months' time called the Research Inclusion Toolkit. But I'm going to take you through some slides that are both a kind of combination of the old and the new, and that help you to think about this research life cycle. So first of all, when it comes to your research question and rationale, it's really key in that background and rationale part of your application to highlight specific health and care inequalities that are relevant to the research topic, and to recognise whether there are particular underserved groups that have worse experiences, worse outcomes, maybe delayed diagnosis, that have less good experiences of care or find it harder to navigate care, that might help to drive your sampling strategy and indeed your research question. So it's really key that that is part of kind of how you contextualize your research idea. And as you start to look at the literature, it's really important to look at whether previous research has excluded certain populations. Maybe they just weren't part of the research, or maybe they weren't disaggregated, so you don't know what their particular experiences or outcomes are. And that might, again, help to drive a research question or area of focus. It's also important to reflect on whether there are any particular historical and structural issues that might affect whether and how people participate or are involved in research. And so there are lots of kind of historical issues which have caused inequalities and discrimination, and some significant medical atrocities as well, that have often unevenly impacted people that are underserved or marginalized. And so the example on the slide is the radioactive chapati study that some of you might be aware of. So this was a study that recruited South Asian women, many or most of whom didn't speak English, in Coventry in the 1960s. And they were recruited for a study which involved them consuming chapatis, which were kind of hand delivered to them each day with radioactive content in them. And they weren't properly informed about the ingredients of the chapati, or why they were being asked to consume it, or any potential side effects. And it was to study kind of iron absorption. So there were huge issues in terms of the targeting of this research, or the focus on a group of people that weren't able to give informed consent because of their kind of English language abilities. And these sorts of examples, and another is the Tuskegee syphilis study in America, which recruited African American men into a study that was very controversial. Stay in people's collective memories. So even though they were quite a long time ago, even though we might say that standards of ethics are different now, that, you know, as a research community, most, if not all of us, have very good intentions. There are these issues around, you know, trust, and people being worried that they might be treated as guinea pigs or they might be exploited or harmed, that are very real and that we need to engage with as researchers. And things like community engagement and public involvement are really key to kind of building bridges and understanding and not shying away from some of these issues. When it comes to research team, something that's really important to recognise is that NIHR is not going to assess your research team in terms of diversity. So this isn't about taking a tick box or quota approach to saying you need someone from a particular ethnic group, or that you need someone from the LGBTQ plus community, etc., to be part of the study team, because that's a tokenistic approach. It's really more about thinking through whether your team has the capacity to deliver your research inclusion plans. So do you have the appropriate connections, skills, track record, maybe language abilities to be able to deliver your research? And underpinning all of this is that although diversity isn't going to be assessed formally, it is really valuable to have diverse perspectives and experiences and backgrounds in your team, because it tends to lead to more well-rounded kind of development of solutions and thinking through issues, and not kind of overlooking certain things that, you know, might be the case if it was a really homogenous group of people. And in all instances, though, we also need to think about the cultural competence or cultural humility of the team. So it might be that some training needs to be factored in and costed for as part of the application. And it's also important that there are opportunities for all team members to meaningfully contribute. So not just to be there to look diverse, but to be able to influence and shape decisions. So that's quite an apt link to thinking about how members of the public and communities are involved in research. And these questions on this slide were co-developed with our public contributors, who were really keen for researchers to make sure that they were kind of doing their homework in relation to the groups of people that are particularly underserved or that they particularly want to include in their study, and to understand some of those historical and structural issues and inequalities that I mentioned earlier. They also wanted researchers to really think about how they would recruit and, importantly, retain public contributors from diverse backgrounds. And so that might mean sort of thinking about a more multi-pronged approach to recruitment of public contributors, being able to get sort of fresh voices and fresh perspectives, maybe from people that are new to public involvement, but being able to appropriately induct and mentor and support them as well. And it's really key also to think about how to provide that ongoing support, some of which might be sort of practical arrangements, making sure that activities are accessible, making sure that there's appropriate reimbursement for travel or care costs, hiring rooms in community venues that are more kind of accessible and comfortable for people, more familiar. But also thinking about power relations. And I don't think we can ever completely eradicate power relations when we're doing funded research, but to really sort of reflect on how to sort of try and dismantle some of those power structures that can make public involvement sometimes a negative experience, because we're expecting public contributors to fit in with the way we do things, formal agendas, etc., rather than being sort of what is in their sort of comfort zone. When it comes to sampling, thinking about both who will be part of the study or which data you'll use if it's routinely collected data, and thinking about study sites, it's really important to consider generalizability. Maybe choosing some contrasting sites if you're doing primary research, or thinking about sort of particular issues with data sets that you might be using if you're using routinely collected data. For primary research, if you've got exclusions, then is there a sort of solid justification for those exclusions, or are you making assumptions about age or English language ability, for instance? And thinking through geographical need, as I've mentioned, looking at areas where disease or care burden is high, but research activity is low, or thinking about less accessible settings, such as more rural and coastal sites. And also looking at what data you're going to collect on diversity and how you're going to collect that data. And that might involve conversations with members of the public in particular. When it comes to data collection, we're kind of beginning by asking how inclusive your data collection strategy is. And as I mentioned earlier, a lot of the methods that we use have quite a lot of inaccessibility and exclusion kind of baked into them. So we think about some of the issues with self-completion surveys, but also some of the assumptions we make about, say, focus groups and people's comfort with simply turning up, being part of a group of people that often they don't know, having questions sort of spontaneously given to them that they need to then sort of respond to on the spot, them knowing how little or how long to talk for, how to manage things like turn taking. You know, there's actually a lot of assumptions that we're making where many people would struggle with that, or they wouldn't find it an enjoyable process. They might find that quite anxiety provoking, and you simply might not get the richest data from them. So thinking through whether perhaps more kind of participatory methods, more creative approaches could be suitable. So there are approaches such as photo voice, photo or music elicitation approaches, walking interviews, different, whole range of different approaches that could be used that could give you some really rich and fascinating data and insights, but also enable people to participate more on their own terms. So that's maybe a slightly more radical take on methods. There are then kind of perhaps more conventional things we can do around inclusion in terms of thinking through, the timings of research activities and how flexible those are, the locations, whether we can do any kind of remote or community-based follow-up rather than asking people to travel all the time, thinking through digital inclusion and exclusion, thinking about whether you need sex or gender specific groups or facilitators for some intervention or research activities. So these are really important to kind of show that you've thought about specific considerations that are relevant to your study. Because sometimes what we find as advisors is that people make really well-intentioned claims or statements about wanting to be inclusive, wanting to make sure everything's accessible, planning to recruit a diverse sample, but they don't really substantiate how they're going to do that in the context of their study. And so when someone looks at what you're saying about research inclusion, try and make sure it's specific to your study rather than it being, feeling quite generic and like it could relate to any study. Now, when you get to data analysis and presentation, it's really key to have already thought through how you're going to describe participants' demographic characteristics, and some of this terminology can be quite context specific. It can also evolve very quickly, such as terminology around gender and sexual orientation. It really does require kind of quite careful handling to think that through. And there are also potential issues around, how you analyze and report demographic characteristics. So in qualitative research, you might want to make sort of greater use of some of that demographic data to contextualize your analysis. You might want to code for specific kind of equity issues. You might want to sort of think about negative cases in the data and whether there's any kind of pattern or relationship around demographic characteristics. And when it comes to quantitative data, it's often advisable, and certainly for the sex and gender policy, it's a requirement to disaggregate findings by sex and or gender, but to consider other pre-specified subgroup analysis as well, in order to, be able to do that more fine-grained analysis. Now, those analyses will usually not be powered to detect statistically significant differences. So it's really important that we handle that data carefully. But we can simply also, do that analysis for more descriptive purposes, and then also have it available for future meta-analysis too. And another kind of dimension to consider is, have diverse perspectives been part of interpreting and analysing the data? And so it's really valuable to have more than one person involved in making analytical decisions or doing some of the initial coding for qualitative work, and to look at how maybe public contributors or other stakeholders could be part of that process too, in order to be able to sense check those interpretations and make sure that it's not coming from perhaps too narrow or limited a perspective. Now we then move on to the penultimate part of the cycle, which is knowledge mobilization and impact. Now we used to refer to this as dissemination, implementation, and impact, but increasingly NIHR's terminology has shifted to knowledge mobilization. And the difference, I suppose, is quite a significant one, that dissemination feels quite focused on an end of project activity once you have the findings, but knowledge mobilization is something that you do from the outset, or perhaps from even before the study actually commences. So it's how you work with varied stakeholders to be able to plan out what knowledge is needed, how that should be communicated, how any new knowledge should be made sort of relevant and useful and usable to the different groups that would be the beneficiaries. And there is an aspect there about dissemination in terms of thinking about how you'll share your findings in accessible ways, creative approaches, things like animation, or using things like TikTok potentially, even thinking about sort of board games that could be used for training healthcare professionals, potentially, as well as some more conventional outputs and channels. So really thinking through those audiences and making sure that members of the public are one of those audiences too. And then thinking through the pathway to scaling up, whatever it is that you've been researching, if it's been developing in sort of new intervention or a new care pathway, then how will that reach a wider range of patients and service users and settings? Would additional research be needed, or have you been able to design the research with some of those implementation and equity kind of considerations in mind? So then finally, we get to budgeting. And this is where we get to the point of, okay, so how much is all of this going to cost? And in the toolkit, what we do is to map budgeting kind of considerations against all of the other areas and parts of the research process that I've talked about, and think about some of the cost and the time implications. And as I say, this is an opportunity now to include these costs and specify them and justify them as part of your application, because historically researchers have sometimes been concerned that if they include these costs, it will make their bid less competitive. Whereas the message from NIHR now is that your bid will be less competitive if you don't recognise research inclusion and you don't appropriately cost for it. So there might be particular costs to factor in. It might be the costs of those more creative forms of dissemination and getting some appropriate design input or live scribing or other kind of support. It might be hiring space in community venues. It might be working with community engagement workers or training up peer researchers to be part of your research team and to kind of be a bridge between the research team and the communities that you're seeking to access. And yeah, so there might be all different sort of aspects that you need to factor in that will be quite specific and personal to your studies. There might be some time implications, and this is where really some of the biggest costs can come in if embedding research inclusion will kind of elongate your recruitment process or your kind of data collection time periods. But there are also things that you can do to kind of maximize value for money. And that might be using outcome measures that have already been translated, if there's an appropriate outcome measure that you might consider. Things like I've already mentioned, kind of using working with peer researchers or community engagement workers. That can be very cost effective and very beneficial for developing sort of trusting relationships with communities. And another tip is just not to blanket translate in written form all of your research materials into different community languages, because it's not always the most cost-effective thing to do. It's not always the most inclusive thing to do, because people aren't necessarily literate in the languages that they speak. So it's understanding different communities and the best ways of communicating with them, and whether a video, for instance, might be more appropriate than reams of written materials. So just coming to the end now. The QR code and the web link on this slide give you access to the current version of the EDI toolkit. And there are lots of other useful resources. Quite a few of them in this field have been developed for trials, but there's been relatively new guidance for evidence synthesis, and other sort of include guidance on underserved groups. And you may well have heard already during the course of this week, but the NIHR RSS Toolbox will be launching soon, and that will have a plethora of different resources for you. And there is a kind of curated, annotated set of research inclusion resources, which I hope will be useful for the research community.